Good morning, Commissioners. Deanne McCann, El Paso County Economic Development Manager. Today, Chris Garvin had hoped to be here. He's with Department of Human Services to really introduce this item. The Pikes Peak Continuum of Care, as you may know, is our effort to raise awareness about homelessness and address those issues. Both Chris and I serve as non-voting members on the Continuum of Care. And we have today with us Shawna Kemppainen and Ann Beer to really provide you with an overview of the progress to date and where we are with this. I also want to really applaud the Continuum of Care members. It is a time-intensive, sometimes gut-wrenching event, or our meetings can be a little intense at times. So Jen Polk is here also. She is on the Continuum of Care. We have a board of probably 15, although Ann can and Shawna can better articulate that for you. But it is really a very committed group, and the volunteers who serve on it, I'm always impressed with their efforts. So without ado, Shawna and Ann are here.
I'm Shawna Kemppainen, and I serve as the board chair for our Pikes Peak Continuum of Care. I was able to speak with you about a year ago, so I'm very glad to be back and talk to you again. And this month is my last month as the board chair, but we'll be continuing on with the board. And Ann Beer does a tremendous job with the Pikes Peak United Way, which administers our local Continuum of Care. As Deanne mentioned, our role is really the umbrella organization to strengthen and promote solutions that end homelessness in our community. And we first have to say thank you so much, because Deanne is on that board of directors, as is Chris Garvin. And not only that, but all of the work that the county does, a compassionate county, the way that we see it, CDBG consolidated application. You've provided matching funds for our homeless Summit to End Homelessness last fall, and you've provided funding for other things, so we really appreciate that. So today I'm going to just go through three things, essentially, give you a little impact update of what's happened over the past 6 to 9 months, and give you an overview of our strategic plan framework and the key goals, and finally talk about the 2016 commitments that we have. But before I do that, just as a reminder to you and to folks out there who are not aware of, Continuum of Care is really created by the Department of Housing and Urban Development. And its goals are to promote a community-wide commitment to the goal of ending homelessness. What we do in the Pikes Peak Continuum of Care is then really localize all of those efforts so that we can quickly rehouse families and individuals who are experiencing homelessness. We're going to start with people, because as we've gone through our strategic planning process this last year, that is the number one thing that has emerged, is everything that we do has to be now centered around the people who need our help to get on with their lives. And I want to point out that what we do really works. You'll see in this slide that 74% of people who are in transitional or rapid rehousing programs, when they were through that program, entered into a permanent, stable sort of housing in some way. And 90% of people who are in a permanent housing program remained there and stable. So we're working on this, and it works. In 2015, we worked with 4,189 individuals, and you'll notice that 534 of them were veterans, and I'll talk a little bit more about that in a moment. We have 1,491 beds in our community, and including emergency winter beds, 228. We've been growing this consistently. The impact to our economy and the funding that we bring in, you're probably aware of, but our Continuum of Care draws down from the federal HUD program $2.2+ million a year. Those funds are allocated through a rigorous process to agencies that are primarily over 60% doing housing work. We also then coordinate over $5 million with different entities such as VA, HUD, the city and county community development block grants, and emergency solutions grants. All of those are vital to providing everything on the continuum, from the emergency shelter that's needed to essentially housing. And one thing that we want to point out here is We really couldn't do any of this, again, without the entities from the government that are stepping forward, combining with the nonprofit and private sector. So thank you for that. I'm really proud that in the last year, I think the biggest thing we've done is eliminate some of the silos. And I think Commissioner Lathan, you mentioned that earlier in another program. So we're still all doing our individual work. I happen to serve as the executive director at Urban Peak, Colorado Springs, a youth shelter program here, but we also commit a lot of time to our continuum of care. So what we have really spent in the last year as a governing board is really activating our governance. We had our annual HUD required point in time count and the housing inventory count. We do not draw down money unless those counts are done accurately. And again, Ann Beer and her team at Pikes Peak United Way are tremendous leaders in that effort. Of course, we had to make sure we turned in a stellar continuum application for homeless assistance funds. We continue to do that. And always providing the data for reports that we have to provide to the government and other entities, because we want folks to know how important their investments are and what we're doing. I think that the two working groups we've really focused on this year as a continuum are getting coordinated assessment and housing placement, starting to get that in order. And that is something, again, required by HUD to draw down this funding. And of course, the biggest chunk of our time, especially in the last 6 months, has really been on strategic planning. So we are also about strengthening our capacity across the continuum and in our community to serve people experiencing homelessness. We have 2 permanent supportive housing projects right now emerging out of the Pathways Home Toolkit, again, that the county helped us in sponsoring to bring here to locally. We know that that's going to not just draw down, rent vouchers, but put actual units into our community, something that we're hugely lacking, a big gap for us. We also are continuing the community homeless assistance providers meetings. That's every month, and they've really gotten focused. If you come to that room, it's anywhere from 50 to 90 organizations somehow involved in homeless service provisions. And they're focusing on a cohort of learning on topics such as housing first and harm reduction, how to really put trauma-informed care into all of our programming, because that's essentially what will help people move from wherever they are. It's one thing to say, we think you should be here, start moving. That doesn't work for most people. It doesn't work for my teenager, doesn't work for me, probably doesn't work for you guys. So trauma-informed care is really about starting where you are. We also have engaged with Manitou Springs and the Fountain Housing Authority and the Manitou Police, and thanks to the commissioners, you guys have been particularly helpful, as has Chris Garvin, in connecting us with those entities. That was something that had been missing, I think, as this time last year. Supporting big collaborations. For us, a focus on that has been ending veterans' homelessness. The Mayor Southers signed on, as had Mayor Bach, to the Mayor's Challenge to End Homelessness. And while we haven't ended veteran homelessness yet, but we are really moving the needle on that. And it really brought to us a great example. If anyone asks you what the biggest challenge is for solving the issue of homelessness in our community, it's the fact that we have money, millions of dollars, into this community to support veterans programs. We have vouchers for veterans to get off the street. We simply don't have the housing units. So we have vouchers, but we have people still on the street because we can't find people to rent to them. So that's, again, something as a continuum we're working on. We're also right now doing the Colorado Action Lab, which is something from the non-Denver metro area that's happening across the state, and it's bringing together a lot of entities to look at the problem of veterans' homelessness. Locally, we have about 6 people that are involved in that action lab, and it's not just folks who you would think normally, work in veteran services. We actually have, from Partners in Housing and from Urban Peak, 2 of our key program people involved in that action lab. Because we think supporting veterans is important, but also we know this is a learning for us. If this project works, it's a 90-day buy list program of how to find someone and get them off the street and into a better future. We know that can be a model. We want to see what would work then. Could we use this for youth? Could we use this for people with families in the future? We're also excited that the Springs Rescue Mission campus development is going on, and that is probably the most collaborative project I've seen in my 13 years of work in the nonprofit sector here in El Paso County. They're going to have a day center, which will be a place for someone to connect for resources. They are expanding their shelter by 150 beds. That's going to go a long way toward closing the gap. We have over a 200-bed shelter gap in our community. This won't entirely solve the issue, but it makes a huge difference. And they're putting forward one of those supportive housing projects. The Catholic Charities and Family Promise have come together to work at the Hannafin Center with Catholic Charities to provide a day center for families with children, and that's going very well as well. So now I want to provide an overview of our strategic plan framework, really, and first to let you know that on April 14th, at 2 p.m. out at Pikes Peak Regional Building, we will be presenting the strategic plan for vote of approval to our Continuum of Care membership, over 80 people involved in that membership, and also bringing forward our new board member recommendations. So we have been taking community input on this project for the past 6 months. We're in a final draft revision now because, wow, we're presenting on the 14th of April, I guess we're going to move that draft. Don't you hate when that happens? It's almost not yet. Yes, right. So the mission of the Pikes Peak Continuum of Care is to end homelessness in the Pikes Peak region. And I do want to say just something about that. When we say ending homelessness, what we mean is doing things differently, not just managing the problem and moving around the dominoes. We know that people who fall into homelessness need a nimble network that they can reach out to and find the different pathways off of the street. Will people stop falling into homelessness? Likely not, because there will always be people who have economic issues, substance abuse issues, the other many things that put people into homelessness, but we want to have a really stable, nimble network to support them when they do. In 10 years, our community will have a durable system of places and programs to ensure that all people facing homelessness have access to housing and the supportive services to sustain their quality of life. The Pikes Peak Continuum of Care is committed to creating the conditions, thanks, Ann, is committed to creating the conditions that ensure housing projects are built and mainstream services are offered to individuals and families experiencing homelessness. So really, that creating conditions is the important piece of this for us. We're doing coordination and strategy, and when we're at our best, we're convening a robust table full of folks who are moving things forward in our community. The strategies that we have in this framework are really about helping people. That's the core of our strategy. And you can read through this, but it's particularly roofs, resources, and relationships. People who fall into homelessness need all of those things. Some need more of one than the other. Continue to help someone stay out of homelessness happens when they have more than just a roof over their heads. So we're very focused on that. The thing that is, I think, shifting for all of us, which is, I'll just be honest, can be a little bit clunky as someone who runs an agency that works with youth experiencing homelessness. We are called now, as all of the agencies working on this issue, to again, look up from our silos and really start to take a people-centered approach. It shifts the focus from an agency-specific evaluation to a person's eligibility for programs across the community. And there are tools that do that. We have working groups particularly working on those tools that HUD has provided and looking at best practices across the country. We're going to have a web of collaboration. That's really what is emerging here. Relevant resources and adding a lot of dynamism to this. Our key goals in the framework, again, are focused on places, programs, and processes. We have to address the immediate needs right now while we're looking at the long-term housing needs. I'm sure everybody, I'm certainly in the line of work that you're in, you have to always keep your eyes up for where you're headed and then know that there's something right in front of you this morning in regards to the health issue with Fountain Creek. You can't just stop paying attention to your strategic planning because you have to work on this issue. So we're in that as well. Primarily, right now we're working on emergency and winter shelter projects as we keep our eyes toward the long-term housing needs. And finally, I'll just cover some of the 2016 commitments that we're making as the Pikes Peak Continuum of Care. We are committed to completing the emergency shelter and winter shelter planning. We will, again this year, as we have had in the past 2 years, have a gap come the summer when the winter shelter closes. But right now, we have moved forward with the Office of Emergency Management at the city and other entities to talk about what we can do for that emergency services over the summer, or if just a shelter facility has an emergency, a gas leak at 1 a.m, what happens to everybody? So we're moving forward with more of those plans. Supporting the launch of permanent supportive housing projects in our community. We know also, while the day centers are going up now, youth and families typically need something a bit different than people who are experiencing chronic homelessness do. So we want to look at what will be the best practices for day centers for youth and families. And we're also going to be recommending the right approaches to come into the day center being developed at the Springs Rescue Mission. Again, they're being very collaborative. We have case managers from all across the continuum who will be working there and officing there. We know also that we need to be more than just something that exists because HUD said so, that we have to get this money into our community. We need to have some long-term funding models, because I will tell you that the federal government is very focused on housing and permanent supportive housing. We think that's right. However, it does mean that projects that require other types of housing, such as transitional, are not going to be able to receive the Continuum of Care HUD funding. We think they're vital to the community, so we want to bring in some other private funding models as well. So I appreciate the chance to share all of these commitments with you, and again, thank you for all of the support that you've offered to the Continuum of Care. We are supporting the places and programs and processes that are going to help people exit homelessness in our community, and we'd be glad to take any questions that you might have.
Commissioner Heise.
Thank you, Madam Chair. I've been aware of this group, well, since I guess you were stood up, and they're all laudable goals, and you almost touched on it in a couple of areas, but how do we get to the point where we don't have as many homeless needs? We could bring them all in and give them build some nice big apartment complex and eliminate homelessness, in that manner, but that doesn't solve the problem. That doesn't deal with the people need. That just moves them from the creek to a shelter over their heads. And if I'm paying for that shelter over their heads, it didn't do them any good. Well, it's not true. It did do them good, but that didn't solve the people problem. So how do we solve the people problem and not just the housing problem?
One of the things is when someone does get into an apartment complex or even shelter, they are off the street, their immediate safety is improved, but also they're costing the community less money in taxpayer dollars. It costs far less to house someone in an apartment, even with case management and support and helping them get to a food pantry, medical appointments, anything they need. That's far less expensive than allowing them to stay on the street. So in that way itself, the housing is a solution, even beyond the particular person. But I think what you're getting to is something that, honestly, as a board, we haven't moved to yet, which is what has to happen upstream. So I think a little while ago, you saw a presentation around ensuring that families have access to the money that they need to raise their children. So that sort of programming absolutely helps. But looking upstream at what we really need to do to solve some of this is going to be a big issue. A lot of it does get influenced when a family gets off the street and they get traction. And I think I'll just think of Partners in Housing, when they have a family that comes into that program, gets some employment and education, and then is able to eventually move out, that has ended homelessness right there and a trajectory for those kids that they might have. I don't know, Ann, if there's anything else you'd want to add.
Just a couple things. One of them, Ann Beer with United Way. One of the items is really, to Shawna's point of thinking upstream, United Way is working on the decade of difference. And part of the reason for that, and by the way, it's also what Urban Peak does, is looking at our youth and ensuring that they are ready for a future. The more we can do that, the more we can prevent homelessness. For people who are already homeless, a big piece of it is doing something, and this is where it goes way beyond the continuum of care, but doing something about the gap between the cost of housing and the income that people have available for that housing. When we talk to people who are on social security disability, so for our chronic homeless population, these are folks who have serious mental illness, maybe physical or developmental disabilities. When their income from social security or whatever the method is doesn't keep up with the cost of living, they can become homeless again. So Long-term, we really have to look at that gap between the cost of housing and the income that people have available to pay for housing.
One of my questions is, and I'm happy to hear you say that that we're not going to end homelessness. I mean, we'll always have them within, but how can we minimize that or reduce risk? Is there something out there that is a gradual model to where we obviously do the hand up, not a handout? Because it's my perspective that every citizen that receives safety net services should have some skin in the game themselves. They should be working, they should be contributing in some way, shape, or form. The second thing I wanted to talk about is just, we have a lot of different strip malls that are vacant, and they've been vacant for quite some time. And talking to developers about turning those into condos, 1,000 square foot condos, et cetera, so that at least they're receiving, A, some remuneration instead of having just an empty facility, and B, it will provide low-cost housing for those individuals as well.
In regards to housing, whether it's a location at a strip mall or some existing building, we do see across the country, and it certainly would work here as well, for new housing programs to come online, not to have a building be built on a piece of property, but we already have some things that can be repurposed. One of the exciting things that came out of the Pathways Toolkit, our cohort learning, is the 2 projects going forward are applying for low-income tax credits. That's the thing that makes it attractive to private developers. So, for example, Norwood has a lot of skin in the game with this, with the Springs Rescue Mission as they move forward on their project. There are great examples across the country. Every community is a little bit different, so really we're looking at what we have to do to localize that. But we know that permanent supportive housing and enough shelter space, having those 2 things are absolutely necessary. Then all of the supportive services and transitional housing that has to go along with that.
What about addressing like the graduated model where, people, it's like a child, right? You help them a lot in the beginning and do everything for them, but then require more accountability and less reliance upon the services that are given.
I can probably speak to it best from the perspective that I have every day, which is working with 15 to 20-year-old young people who in some respects have not had to hold themselves accountable for much because they maybe came from families where there wasn't accountability, wasn't a priority. What we know is that meeting them where they are with whatever that goal is, and that applies for, I think, anyone, and helping them see where they want to go and what they'll have to make happen for themselves to get there, and then saying, great, these 5 things will help you get there. These 3 things we can help you with. This thing we can connect you to someone. Just really working with, it's so different for every person. So as you talk about we do that at Urban Peak, sort of a graduated, it's first, just get some rest. If you've been sleeping on the street for a month, you need a little bit of time just to ease yourself back down, and then start to talk about education and employment goals. And we have rules. So all of those things start up. I think in every program that I know across the continuum, we have that.
You mentioned the skin in the game, and I think that's really an important point of all of the projects, all of the programs that we have in the community, that they expect their clients to participate. When somebody, particularly chronically homeless, for instance, comes into a program, their participation might be that they actually meet with a case manager once a week. That might be the level of participation. But we know, even in our Housing First programs, that people immediately reduce the amount of consumption of alcohol once they have a roof over their heads. They also begin to get medical care. So to your point, that graduation, you start with a whole lot of wraparound services. I think one of the things that we sometimes have some difficulty understanding is that we could be looking at a 45-year-old person who has the decision-making capacity of an 8-year-old. So when you look at that trauma-informed care, that's one of the things as a continuum we've really been coming to understand. The brain is impacted the earlier the trauma occurs, whether it's poverty or homelessness experienced as a family or abuse in the family. The earlier that happens, the more the decision-making process is impacted. So part of our role in our programs is to help people learn decision-making and take someone who's 45 but has a decision-making capacity of an 8-year-old and bring them up, and that takes time.
I think the mental health piece, the developmentally disabled, the substance abuse issues are relevant, but I think there's also a difference between chronic homeless and those that are maybe just on the edge or have just become homeless that we can help to find other means of living. And then there's those that are out there on the streets who are not necessarily homeless, but are asking for money. And we see them all the time. They work in teams, pull off the interstate, and you can see them working shifts to come back and forth. And I don't know if those folks actually have a home or not, but it's kind of a predicament that we're in right now in our community. I want to know kind of at what point do you enable and just give people a permanent place to live for free? And how do you determine that they are really those that either will never find a permanent place unless we help them, or those who just need basically a hand up to get back on their feet? And I know United Way has 211, and I respect United Way tremendously, but I have referred folks to 211 who have then called me back and said I didn't get any help. And so, and these are folks that are just kind of on the edge of being homeless, but are not at a point yet where they're there. And if we don't help those, then they become part of the bigger problem. And I know it's kind of a multifaceted, maybe what I'm saying is more comments than questions for you all, but I think those things have to be addressed. And I do appreciate the city being engaged, because the CDBG money, the community development block grants, are important. But the county really truly is a safety net. And one component that's missing, I think, is the fact of our jail system is also becoming a housing unit for those who have no place to live. The issues we're dealing with substance abuse, and they end up in our jail system, and the mental health problems that our sheriff has to address, and we do in our budget because we house those folks. That is a component that needs to be at the table more fervently, because if we don't address it, over 50% of the folks that are in our jails nationwide, which we spend approximately $80 billion nationally on housing jail inmates. I'm not talking about state or federal prisons. I'm talking about local jails, which are primarily under county government. We are seeing an increase in those with mental illness in our jails, and that's not the best place for them. And then they keep recidivating so that they can get housing, they can get free medical care, they can get free dental care. Not the best place that I would want to be. Been there, done that, toured the jail a number of times, in jails around the country that are in much worse shape than ours. But I think we need to bring in the judicial system into this discussion too, because a lot of these folks get in trouble and then they end up being housed in our jail system, and that's an expensive way to house folks that are homeless. I'm not expecting you to have all the answers, either of you. I know how passionate you feel about this issue, but I just want to make sure that all the right folks are at the table and that we're not forgetting a major component that costs this county money every single day when these folks are in our jail system.
We have obviously the city's homeless outreach team, and their police department on whole is tremendously engaged in this, but we probably can do a better job, particularly with judicial. I thought it might be helpful if just Ann talk really briefly about the SPDAT, just how we prioritize and know, how do we get the people in most need.
The VI SPDAT, and I won't even get into what the acronym is, but it's an assessment tool. So you are asking, how do we differentiate between someone who needs a whole lot of support and someone who just needs a little bit of support? So nationally, there have been tools that have been being worked on to do exactly that, and the VI SPDAT is exactly that kind of assessment. We are working with it locally. There are 3 that they currently have. Have been tested in a number of different communities, including some of the ones that we've looked at. There's one for individuals, one for families, and one for youth. And we are currently testing out those assessments and then adding to it additional questions to get at exactly what you're asking. They measure vulnerability, chronicity, which is the length of time chronically homeless and how severe the chronic homelessness is, as well as the medical vulnerability, including developmental disabilities, mental health, and so forth. But then also also getting down to a much lower level of need of folks who really just need some supportive services to get back on their feet. So the development of those assessment tools and the widespread use of it across the community is part of what's really going to help us with that. Shawna talked earlier about changing from an agency focus to a people focus. That's another portion or part of our coordinated assessment and housing placement, is making it so that it doesn't matter where a client shows up, they will get a common assessment, determine what they need, what level of intervention, and then get them to the right location.
Shawna, I want to thank you for chairing this. You're exactly the person that I think should have been, and perhaps still continuing, because of Urban Peak. You've got the right model there. You know, you've focused on a fairly narrow slice of the pie of the whole homeless picture, so it gets much more diverse when you move away from that. But you bring them in, you're welcoming, you give them a chance to, I think you called it rest up, but also this doesn't last forever. Let us help you, because you can't be here forever. So let us help you become, you know, what you need to be. And again, you know, you're dealing with not the 64-year-old vet. You're dealing with young people that have their whole life ahead of them. But appreciate what you do.
Thank you.
Thank you very much. Appreciate the report.